Do you know that 70% of cancer patients have problems related to function, balance, and mobility? While there are several modalities to fight cancer, one modality that is important but not emphasized by the physicians is exercise. Very few patients receive treatment recommendations for a formal exercise program. I would like to list benefits of exercise in cancer patients. There is improvement in symptoms from cancer. There is improvement in strength and function. And through function, there is improvement in independence. Independence leads to emotional well-being. Final goal of exercise is to improve the quality of life. A formal exercise program is beneficial before cancer treatment, during treatment, and after treatment of cancer. The exercise program before cancer treatment is a preventive program to prevent functional decline of patient during treatment. Goal is to maintain good function so that patients can get through scheduled treatments. This preventive exercise program improves survival from cancer. In one study done in colon cancer patients, patients had less risk of colon cancer recurrence if they were enrolled in an exercise program prior to colon cancer surgery. Exercise program during cancer treatment helps support and maintain function. Patients who were in an exercise program had less hospitalizations during treatment. It also helps improve symptoms of cancer such as pain, fatigue, constipation, sleep issues, and depression. A study in breast cancer showed that low muscle mass and higher body fat is associated with higher risk of dying. So exercises designed to improve muscle mass and to decrease body fat will lead to decreased risk of death. Exercise program after completion of treatment helps with patients' recovery after treatment. It also helps with symptoms such as pain, fatigue, and depression. Avoiding inactivity and maintaining healthy body weight helps with cancer survival. Exercises can also help patients at the end of life by improving pain, enhancing mood, decreasing fatigue, and to help sleep better. Let us discuss about how much exercise is needed for benefits. Recommendations include 150 minutes of aerobic exercise in a week. Strength training at least twice a week is recommended. If you're unable to do recommended exercise because of fatigue or some other reason, please remember that any physical activity is better than doing nothing. We now know the benefits of exercise. Does supervised exercise program help? Does working with a physical therapist or a trainer help? Let us discuss a clinical trial called PACES trial. In this study, exercise was studied in cancer patients. These patients had breast cancer getting chemotherapy after surgery. There are three groups of patients studied in this program. The one group of patients received supervised low-intensity exercise program. Second group underwent moderate to high intensity supervised exercise program, which included aerobic exercise as well as strength training. And the third group of patients just received usual care. They did not get any supervised exercise program. Let us look at the results of this PACES trial. Patients on both high intensity and low intensity exercise program had better fitness, better function, less nausea and vomiting. There was also less pain, earlier return to work, and ability to work longer hours compared to patients who were not in any exercise program. Let us compare between high intensity exercise program versus low intensity exercise program. In this particular study, it was shown that moderate to high intensity exercise program having both aerobic and resistance components is more effective in patients with breast cancer undergoing chemotherapy compared to low intensity exercise program or usual care. Those on high intensity programs had more muscle strength and less fatigue. They were also able to tolerate full doses of chemotherapy better without dose adjustments. In conclusion, a good exercise program is beneficial because it prevents decline in function and causes less disability and helps maintain independence. It improves emotional well-being and quality of life. It also improves symptoms from cancer such as fatigue, pain, constipation, poor cognition, depression, and sleep issues. Better ability to tolerate treatments It also improves cancer treatment outcomes. It decreases the risk of cancer recurrence and improves survival from cancer. Also, please remember that any activity or exercise is better than being sedentary. Your physician may refer you to a formal exercise rehabilitation program depending on your symptoms and condition. Thank you for watching this.